I have great pleasure in opening this seminar open so that all the discussions and the talks will go on and people can listen to it and go back to their homes and see how they can correct the situation arising out of this required for this good health of this adolescents in our country. Thank you very much.
Thank you so much, sir, for coming. And I thank wholeheartedly Professor Srinivasan Indeswaran, the Managing Trustee, sir, focusing on the most of the time neglected topic of adolescents who undergo so much of changes unnoticed. And I also thank the speakers, Professor Kannan, Dr. Vimal Doshi, and Ms. Kavita, who have come here to deliver talk on Adolescent, and Dr. Venkatesh, who has arranged all this. And just to say a few words, we know that everybody in a public or in everybody thinks adolescence means just a change. A girl grows up, a boy grows up, his voice changes. But we all know it is just more than that. And we also know that they not only undergo physical changes, they undergo psychological, physiological and social changes, which most of the time goes unnoticed. It's a hormone-driven growth. Plus the society, everything is going to shape them, and even the brain develops and matures at that time. And if the society does not give him the support or her the support, she may not form the correct idea. She may not choose the correct career. And we know they are more prone for mental depression, they are more prone for suicidal tendency, they have behavioral problems, they have learning issues. Everything should be addressed. We know that the problem is very core. It can be with the school, it can be at the tuition centers where the children are facing problems. So unless the parents and the school open to this, we will not be addressed. So such an important topic, and what we have seen, the sad part is the adolescent psychological issues in this lockdown of Corona. They are not able to go to school, and all online classes, and they are expected to pay for the exam. Plus, to imagine talking to those children, we know that they have so much of depression inside, they have got so much of anxiety, and I know really we are scared. We have to counsel them not to think of. Most of them have a suicidal thinking that we have seen, and unfortunately we have seen recently also such an incident. So we feel that at this time it's an ideal. I really thank the organizers for arranging this, and really it is thing with not too much waste the time of everybody. Let's go to the CME. I thank again one and all of you for this wonderful opportunity. Thank you so much.
Medical College is more than 15 years experience in psychiatry. Above that, he is more interested in children, their problems, especially academic ones. What are the policy decisions to overcome these problems and help these children out? Day in and day out, he deals with these children and their families, as well as teachers, school teachers and other people. It gives me immense pleasure to invite Dr. Kannan to share his ideas about scholastic backwardness and its impact on the whole of the children's families as well as in the environment. Thank you. Thank you very much. Welcome, Dr. Kannan.
Good morning to everyone. It's really very pleasure to be here and to share my views about scholastic backwardness with you. At the outset, I thank our chief guest, eminent scholar, Vice Chancellor of Anna University, for touching upon few issues related to mental health, the taboos and the barriers in accessing mental health. I think it's a very important issue to understand the barriers which are preventing us to reach the right person. Subsequently, during the press conference, our clinical psychologist had mentioned about the issues related to adolescence and how to get over it. Yes, there are lot of issues. When we discuss about mental health issues, it's from A to Z. And it can be a severe mental illness where one can be talking to himself, laughing to himself. At the other end of the spectrum, the interpersonal problems, one having difficulty in relating with others. And yes, in the same end of spectrum, we can also look at children having difficulties in reading, writing, understanding concepts. Everything is done, but a difficulty in expressing it. So, I am going to focus that aspect of that spectrum. So, this is not about any particular illness. This is a broad idea of scholastic backwardness. Next. So, what is scholastic backwardness? Child is not able to perform in school. Child is not able to meet the expectations of the teacher, parents, and child is not able to meet the average set by the society and the schools. If it is a highly competitive school, probably the average is more. If it is a small panchayat school in the interior of Tamil Nadu, probably the average would be less. If child is able to read a sentence, then that itself is a great achievement. So, the average. See, whenever we come to psychological issues or issues of mental health, we go by the average. The normality, one have their own idea about it, and pushing that idea on others, that leads to the lot of problem. The scholastic backwardness is one such thing, and we set standards and expect children to perform to that standard. When child is not meeting the standard, we call them suffering from poor school performance or scholastic backwardness. The prevalence, that is, how many children have this kind of problem? This varies. If we go to a government run school in interior, probably it would be more. When we come to a highly competitive and highly qualified teachers participating, and the school which is focusing only on exporting students to higher education institutions of abroad, probably there it would be less. But you all understand that mental health issues and the suicide, which was discussed during the introductory sessions, are more high among those highly competitive schools, where every mark is counted, every mark is valued, and a child's real potential is missed out, and a child is given a goal and a child is expected to perform to achieve that goal. So, this varies according to the way it is being measured, but a crude estimate is it is 15 to 20%. It may go even up to 50%, it may get reduced even to 5%. It's a common phenomena. The phenomena is how they understand it. So, multiple factors, say 100 factors. If you ask me, I will enumerate 1000 factors for the scholastic backwardness. From the few sentences I had said, we can understand the societal system, the educational system, policies, and the teachers. Everybody are involved in claiming a child is having scholastic backwardness. So, there is no right proper definition about education, curriculum, and the way it is assessed. So, going and telling that the child is scholastically backward is again a controversial one. But still, let us accept the way it is being measured in society and educational system, and let us pursue certain things. At the outset, we all need to understand that there are so many variations in it. There is no exact definition for scholastic backwardness. For a common man, it is a poor performance in an exam system and scoring low marks, and subsequently he is not able to achieve something. So, one important point in scholastic backwardness, a learning disorder. Everybody known this particular entity as dyslexia. And so many factors. I am just discussing few things because scholastic backwardness itself is a big topic. I cannot cover everything, but I am going to talk about few sentences about the points which attracts common man and teachers and educators. So, I thought of first touch upon dyslexia so that people will feel that what they are looking for is presented here. So, it is a neurodevelopmental disorder. There is a circuitry problem in brain, and the children would be presenting as getting low marks or disobedient, or he is not listening to me. He has potential but not performing. So, what is the prevalence of this particular condition? It is said about 15 to 15.17% in India according to the current Indian Journal of Psychiatry. Again, the prevalence can be disputed based on the tool, how it is measured, in which school it was administered, who measured it, but still let us accept a crude method of measuring it. When 15%, think about a school claiming that we are sending 200 students to a medical college, we are sending 100 students to IIT or Anna University. There is a problem in admission. They are filtering and taking up only the high performing students in a particular area. They missed out students of various talents because their filter not working there. And the society is also focusing on the only one filter. So, the lifetime prevalence according to AAP is about 9.4%, roughly it is 10%. That is, whenever you see 100 children, 100 adolescents, 10 among them are having this problem, circuitry problem. Then how the schools say that 100% pass, 100% we are able to give that good results, we can take the students to? There are issues which may fall in the social domain, and probably sociologist and the educational specialist can discuss on that. And the behavioral problems associated with this scholastic backwardness, it is about 60% in children having this difficulty with academics, whereas those having normal academics too, they have behavioral issues. நல்லா படிக்கிறான் அதனால அவன் நல்லவனா இருக்கான் அப்படி சொல்ல முடியாது. So the behavioral issues happens with every children. It is more common among children having this scholastic problem. Maybe this is because of failure of the parents or society or school system to understand the child in correct perspective. So this is to enlighten that neurocircuitry problem of children. The first is a scan done in children suffering from severe dyslexia. The second one is children having normal brain activity. Child is not able to perform academics, reading, writing, mathematical problems. He is able to do well. His brain scan. Why I am projecting this? The child is not demanding and creating his own brain. It is given by the nature. So child is not responsible for his scholastic backwardness. That's the point I want to mention here. So let us all accept the child's nature and work on the nature influencing the child and help the child out of this. This is another one scan. I am just trying to simplify my points. It doesn't mean that all children having scholastic backwardness to be scanned. In fact, these scans are done in research setups, cannot be done in a regular clinical setups or in a medical college. Anywhere else it is not done. It is only a pursuit of understanding why this is happening, why we had worked so hard, why we had given such a fantastic syllabus. We brought in top-end teachers, why child is still not able to perform. When we go on to analyze, we had arrived at that the circuitry problems. The first one is the child is having dyslexia. First one is the child is having normal academics. Second one is having the child is having dyslexia. That is one particular part, that is child's left side brain posterior aspect, that is back side of the brain not activated when he indulges in reading. When you give remedial education, the third brain image, the front aspect, that is frontal aspects of the brain has 4 lobes, no? The frontal lobe that takes up the compensatory work child is able to do. But the remedial education is provided by the school system, the educationist. The educational policies should facilitate this remedial education, one-to-one education. I will touch upon that IEP, individualized educational plan for a child. The third one is child, in spite of all the efforts, not able to perform. So this child is suffering from problem called dyslexia, which had not improved in spite of the extensive remedial education, and we can consider this child is disabled in academic activities. I would mention disabled in academic activities, not because of his or her mistake. And the child should not be punished, or child should not be looked upon as though a backbencher, not interested in studies. It is our system. When I say system, it is a conglomeration of experts and technical people, administrative people, educational people failed to understand this particular issue and evolve that is educational system to address this issue. It's not working. Next slide. What are the academic skills that may be affected? Child may be very inaccurate in reading, or slow, or he will indulge in effortful reading and difficulty in understanding words, difficulty with spelling, difficulty with written expression, difficulty with number sense, number fact and calculation, difficulty with mathematical reasoning. These are all few academic skills which are usually getting affected during the primary school education. Yes. How to understand this? As I told you, when we look at the child having this 4 marks, we only see, நீ ரொம்ப விளையாடுற, நீ ஒழுக்கமா இல்ல, நீ சொல்ற பேச்ச கேட்கல, நீ டீச்சர் சொல்லும்போது கவனிக்கல. Only these things we regularly hear from parents and teachers. 100 factors. If you are good enough, you can understand 1,000 factors related to the child. So certain factors related to whom? For example, whether child is given that environment, economically well-off family would be able to provide a study room, or maybe they can arrange a combined study by inviting friends, friends who are doing well, or they can invite a teacher for home tuition. Or think about another child with a poor socio-economic background, and look at a child who is having in a home environment. Mother is having finished BSc, B.Ed or MSc, M.Ed, or teacher in a school, she will be able to support the child even after school hours. Understand, a child with multiple siblings. Child is having a elder sister who is good at academics, whereas the younger brother is not good. The elder sister would be able to support because he had finished the standard a year ago. So she would be able to think about a single child family where parents are very busy in attending to their professional needs, or they are employed in a corporate firm, returning by 8:30, 9:30, and the maid or caretaker looking after the child till the parents return. Sibling rivalry in which one may do harm to the other, or the jealous of one sibling over the other. So there are issues in the family environment, the interaction of the family, the father's attitude toward the child, parental interaction, the parenting itself, and how father sets value inside the family. Everything matters in the outcome of school performance. When we come to school, again, we can say too many things. For example, the syllabus. Central government is having 3 syllabuses, 3 syllabi, that is CBSE, ICSE and NIOS. Coming to state government, it is state board alone, Samachir Kalvi, and international syllabus. Which syllabus is suitable to the child? We have to work with the child, we have to identify the child, identify the child's strength, and help guide the child to perform well in that particular syllabus. For example, NIOS is highly flexible. You can do it from home. You can take one subject at a time. Whereas if you move to CBSE, which is more demanding. In fact, my niece who had joined MBBS was struggling to study her +1 and +2. When I looked into her books, I was seeing certain things which had been taught in graduate level, and the 9th standard textbooks are containing stuff of +1, +2. Those days when I was doing +1, +2, that stuff I am able to see in the 9th or 10th. So I am not against having different kind of syllabuses, but we need to identify which syllabus suits to which child, and we have to encourage child to pursue a particular syllabus in which a child is comfortable before talking about child is not performing. The next important thing is the teachers, quality of teaching inputs. Without addressing that, we cannot talk about. The input need to be there, then only we can look at the output. Then languages. I am going to spare few slides for this language because it is a highly ignored and forgotten aspects whenever we talk about teaching and learning. Certain languages enhances, eases out learning, whereas certain languages makes the child put more efforts to understand. And the school environment, peer group, the opinion of the headmaster or a class teacher about a particular child, proximity of the parent to that particular child's father or mother. Oh, these are all playing a role, we cannot ignore it. Coming to child factors, yes, this falls in the domain of psychologists and psychiatrists and other mental health professionals, call it as special educators. Child may be having some issues, like he may be feeling low, or he may be feeling helpless, hopeless, or it might have evolved into depression, or he may be too anxious and too much preoccupied about exam outcome rather than how to face the exam, or individual in the family may be suffering from mental illness, and the impact of mental illness on family members may be there. Child himself or herself may be experiencing certain phenomena which cannot be understood by normal people. Teacher having good understanding of the child may be able to pick it out, or psychologist or psychiatrist may be able to understand that inner experiences of a particular child, who are trained, well trained to do so. Then only they can understand these issues. So the child factors, again, we can expand it to physical illness too. Child having anemia, hypothyroidism, or worm infestation, or ADHD. The LD, I just projected few slides, no? The circuitry problem in the brain. We do not want to say all these things. We don't project circuitry problems, but I want you to understand, we don't want to look at children as though they are having some issues. Children having 1,000 issues, these are few issues we are all attracted to, but not understanding it in right perspective. That is the point I want to push. So child may be having physical problem, psychological problem, psychiatric issues, all need to be understood. So the dyslexia, we are all frequently talking about in the context of scholastic backwardness. Child is having multiple, no, I had just mentioned a few things. The cognitive abilities of innumerous. For the understanding purposes, I had mentioned just 12 cognitive faculties. Child is having intelligence on par with other children when measured by intelligent quotient tools, whereas child is missing out in certain abilities which are helping the child to perform well at school. For example, the reading accuracy, the reading fluency, math calculations are missing in the projected slide. Meaning, child is suffering from learning disorder, learning disability, specific learning disability, கற்றல் குறைபாடுகள், கற்கை குறைகள், dyslexia. Dyslexia is an outdated term, but still it's popularly people understand it. So we call them with various names. So how to arrive at this diagnosis or understanding of dyslexia? See, we have to analyze, as I told you, the factors involved in home, factors at school, factors at within the individual. 15 minutes. So then it would be easier to understand and say that this child is suffering from dyslexia. So it can be of mild, moderate, or severe in nature, and severe children need to be taken to a different setting to be given a different inputs. And this is the IQ scale, just oversimplified, and there are a lot of controversies about the way we understand what is intelligence, how it is measured. Just for teachers, I think this is adequate to understand, this is enough. We all, most of the people fall in IQ of 90 to 110. Whenever child falls below 90, we say that child is suffering from inadequate intelligence. When child falls below 70 and impairment in adaptive functions, we call child is suffering from mental retardation or intellectual disability. This is an important thing need to understood, because these children, the children having IQ less than 70 need to be supported in a different setting. Children having IQ more than 100 and having deficits in the school related mental faculties, that is reading, writing, they should be handled differently. So these are all things, that is intellectual disability, neurological issues, sensory disorders, ADHD, psychiatric problem, all these things need to be ruled out. And the dyslexia, the learning disorder, is a lifelong disorder and usually occurs with attention deficit hyperactivity disorder, anxiety, depression, conduct disorder, oppositional defiant disorder. These are all disorders these disorders are construct based on behavioral observations in a consistent manner, gone through certain scientific filters, and we are able to cluster these behaviors and call it by a name. May not be required from teacher's perspective, but just I want you to understand that there are few terminologies which helps professionals to communicate among ourselves. But I want you not to rush to any particular diagnosis. Even I myself think about it, communicate with others, but not interested in giving a label to the child. The impact. Naturally, the child would get depressed, child may become impulsive, or the people may group together. The people who are performing low, the scholastically backward children, may group together, may indulge in substance use. They have different abilities, I told you, no. So, they may try to express their different abilities like creating YouTube channels, trying to make films. Nowadays, these are all more common among children. They come, sir, I had posted so many videos in YouTube. You just, they are requesting me to watch their channels. Maybe good. As we guide them properly, probably he may become one another Balu Mahendra or Maniratnam. We do not know. But we are expecting him to read, write, mug up, write legibly. This is what we insist. So that leads to lot of difficulty with the child. Subsequently, child finds a way to express himself, leading to conflict with the family or society, and we need to understand it in correct perspective. The treatment is completely with the teachers. So medicine is not the way out, and the ADHD may be supported when it is mild. Modifying, manipulating environment, supporting the individuals handling the children may be handled, but a moderate severe ADHD to be treated with medicine. And the anxiety, depression can be handled by counseling. When it is severe, children may be requiring medicine for short period. Don't get have that taboo or a fixed idea about treating this intense suffering with medicines. Don't mistake it. We need to be open. And as I told you, the individualized educational plan to be developed for the child, the progress toward achievement of that IEP to be monitored. The reading disorder, yes, it is in the hands of primary school teachers, not with the doctor, but doctor need to be aware. The people, it's a team, it's not a doctor or a teacher. Teacher is the mainstay of that team, and the educational psychologist, clinical psychologist, doctors, even the pediatrician, the psychiatrist, everybody is part of the team. They give input. The school headmaster or the teacher assigned for that particular child prepares the plan, and he is responsible for doing all these remedial strategies. Yes, these are all remedial strategies related to written expression. This is about mathematics, accommodative education. I am going to finish it in a few slides. Child is not able to perform in spite of all these remedial measures and supportive education. What will you do? Let us accept that child is having issues related to academic skills alone. Or maybe there may be other issues, global developmental delay or intelligence may be bit low, but we have to support the child. Let us accept. When your grandma is not able to walk, not able to climb few staircases, what will you do? You just go and support, and you try to look for a good orthopedist, try to replace it, or you give a prosthesis or give a wheelchair. Similarly, we need to accept the difficulties which is persisting with the child, and we will support by giving extra 1 hour, exemption from second language, allowing the child to use calculator, helping the invigilator to read out the question paper to the child, so that child having difficulty in reading and understanding, but somebody reads, child may be able to understand it so well. So these are all certain issues. Even we can get a support of scribe. The scribe issues not well defined. Currently, the educational system is misusing the scribe system. I would say it because the teachers, they are not adequately trained when to recommend for a scribe. So the policy decisions need to be made in this effort, when to recommend for a scribe and how to use the scribe. The RTA, response to intervention model, is popularly followed in United States of America. The most of the literatures are from America, even though the US model, where we call them a capitalist country, where everything is privatized, the education system is very well supported by government. More than 50% of the educational system is with government. Unfortunately, we are living in a scenario where the education is excessively commercialized. I would not say this is needed. Privatization is needed, but this amount of commercialization not required. That is effect of language. As I told you, there are two language systems. One is alphabetical writing system, logographic writing system. These two language systems use different neurocircuitry in brain, and the dyslexia would get expressed differently in these languages. So, we need to understand that Tamil is a transparent language in which the phoneme grapheme mismatch is very less, whereas in English, which is expected in our current scenario, current societal system, is a opaque language. We need to be aware of the phoneme graphing that connect, and also certain rules, phonetic rules. When the letters come together, the letters acquire different sound system. So, that heavily influences the reading ability of the child. So, that need to be understood, and we have to promote a language in which child is comfortable. I am not saying Tamil is superior, I am not saying Hindi is superior. The mother tongue is different, parents' educational levels are different, child is comfortable in one particular language, it may be a Telugu or Malayalam or Tamil. We have to help the child to overcome the child's academic difficulty by supporting the child's education in that particular language. So, these are all few examples to enlighten that language playing a role in academic backwardness, scholastic backwardness. We don't BUS, BASS, BOSS, everything we call it BUS, we never call it BUS. When the three letters come together, the sound system altered. Unknowingly, we all given the instruction from the beginning of the years, that is from our early childhood years, whenever BUS, we call it bus. If someone, even the 5th standard, கீரை வைக்கிற அம்மா கூட பியூஎஸ் வந்து நம்ம புஷ்னு படிச்சோம்னா சிரிச்சிரும், because she learned that sound system involved with these three letters. But as we exactly apply the phonemes involved with each letter, we will call it BUS, bus, but, kut, sut. Does it make any sense? But it appears to be fun making. But there is a great science behind this, and the neurological sciences are coming up and trying to explain this. This need to be taken to educational policy level. Teachers need to be sensitized, and we have to identify that the children suffering from the scholastic backwardness need to be supported with a language in which child is very comfortable. We don't call it tably. Tably in keliputtingla, TABLE, table. Everyone pronounce it in the way they are given the training. So, the last thing here, the same word, I would read it tomorrow, I read it yesterday. The word itself occurs different sound system when it is placed in a different sentence. We don't have these kind of things in Tamil, the Dravidian languages, because it is a transparent language. The English and the French are considered to be a most opaque languages. If we go to Chinese and Japanese, which is logographic language, that is, it's a more like a drawing. The letter writing is a more like a drawing, pictorial way of expressing a word, where the prevalence of LD, the dyslexia, is very, very minimum or less in those languages. I am not able to. Yes, these are all phonetic. Yes, next. Next. Next slide. These are all phonetic rules. Yes, next. Yes, this is about guidelines required for the children. That is, when a child, teacher recommends a child to a medical board, the teachers need to be aware that a certain format need to be followed before sending the recommendation. That is where the child is performing poorly, and how much efforts made by the teacher, and how much progress child had shown, and what the teacher recommends for that child. That is very important. It is not the doctor who is busy at his clinic and looking at various other problems cannot decide about the child's requirement. The teacher who spends about 300 days of 365 days need to pay attention and give recommendation. Probably the doctor will look at physical issues, psychological issues, psychiatric issues involved with the children, and he or she would support that recommendations of the teacher. Next slide. So there are government orders. The government order related to certifying boards and all rectified. We are also continuously giving feedback. I want the teacher and the educational system also give feedback in coming up with better educational policies and government orders, so that we can reduce this impact of scholastic backwardness, subsequent the consequences on mental health of the children. Next slide. So how it can be, previous one. How it can be addressed? Starting a special stream for children with different needs, strengthening the vocational skills training, and strengthening the institutions for special education and remedial education, providing job opportunities for children having academic difficulties. So this should be kept in mind. It is not that raising children to get admitted in IITs and Anna universities or in medical colleges. We have to look at the students community together, and the teacher should always focus on the child who is performing low, and teacher need to identify why he is performing, has to get the support from professionals like a psychologist and a psychiatrist to address the needs of the children. Next. So this is the last slide, and there are many issues with the children, and it has to be understood in right perspective. It is not the child's mistake. I would say it is the deficit on the part of the people around the child or the system that need to be addressed, not find fault with the child, and let us all help child. Next. So if we provide support, child would be able to come up in a, if not flying colors, at least able to come up with a good self-esteem and able to give contribution to the society. Thank you, one and all.
Really thank Professor Kannan for his points and inputs about scholastic backwardness, especially stressing about the environment which is more responsible in a child's achievement rather than the child itself, and that is what we need to concentrate here. I invite Kavita, Dr. Kavita, to present about self-harm behavior in children. We are all mainly focused about, especially in this pandemic period and lockdown, children have many ideas about self-harm and suicidal ideas, and I would like Dr. Kavita to present about this topic, and she has already achieved an eminent psychologist award. I think she'll be the most suitable person for this job. Welcome, Dr. Kavita.
Right. So you have one person very different from the usual speakers here, or very eminent psychiatrist. I am a clinical psychologist and assistant professor in SIT College and Department of Psychology. I have 17 years of practice with in the field of clinical psychology and as a professor in psychology. So I have dealt with both the normal category of children and with clinical population. The next slide, please. Now, before I could really go into the topic given to me, self-harm, I would first like to speak about the characteristics of the children whom we are talking about. See, I have told you that this is a theorist who had brought this idea, giving names for certain sets of generation. Now, for example, people who are here up to the age of 50, we are all generation X, and we have certain set of characteristics. Yeah, we have a certain set of characteristics that is inherent to, which one is it, this one? Yeah, which is inherent to us. And the current generation up to the age of 25 or so is the generation Z. That's exactly what we are talking about today in this August gathering. And adukku mela vandu we are having one mafia gang, it's called the alpha generation, which is coming up, the ones who are less than 7 years of old, and we do not know what they're going to bring up in the coming few years. So I'm going to focus more on the generation Z and their characteristics. Next slide, please. Oh, sorry. Yeah. So now, when speaking about the generation, these are empirical, these are all research, this is not my personal opinion, these are researched points. One is they are tech savvy. You and me won't know a lot of things, but these kids, if you give them a phone, even 5-year-old, they can actually crack open a lot of things and they can lock the phone, you can't even open it. So they're so that smart, one. Second thing is, they are tech dependent. Even to eat, you have to bribe with the phone. So they are highly tech dependent, and the latest, the gadgets are the things, these easy fingertips for these kids. And the next is the screen time symptoms, of, as I already just spoke in the, during the press, is that screen time is something which we cannot do anything about. Now the psychiatrists say, the ophthals say, a lot of other doctors do say that please don't give phone, don't give iPad, don't give computer, but then where are we right now? For the past 1 year, we are stuck to this, all the mentioned above gadgets in such a way, we don't have an option. அந்த குழந்தை வந்து நீ ஏன் அந்த கிளாஸ்க்கு முன்னாடி இல்லை, sit in front of the computer, and we tie them up, we bring them lunch, we bring them breakfast, snacks, everything as possible. I have seen children in a somersault position having the TV upside down, and they have to somehow see the TV, they have to increase their online. So what happens, the repercussions is that a lot of physical symptoms are increasing, okay, and they're all developing nice dark circles, and they're wearing glasses. I'm wearing these glasses only for the past 2 years, but my niece, such a young age, started wearing glasses, but no other option. And the next is psychological symptoms. Now, I'm not going into the depth of the pathological point, but I do say that when we say a psychological symptom is that, see, when we are looking into the social media, they have Facebook accounts. We don't know what is Facebook. We don't know what is Tinder, Minder and all that. They have accounts everywhere. Why they are jumping into new latest editions is because they have their aunties, uncles and all in Facebook, so they don't want to escape. Earlier they were in Orkut, then they came off to Facebook. Now from Facebook they are now in Tinder, and after Tinder there is something else we cannot access. They are comfortable there. They can swim more easily, express themselves, selfie at any point, and the parents are having a shock of their life when they see such selfies through somebody else's phone. So this is the current scenario, and these kids are like fantastic online, but offline, when they really speak in person, these kids have really lack of social skills. How to start a conversation, how to maintain the conversation, how to close a conversation, what is called closure. நம்ம வந்து சரிங்க நல்லா இருக்கட்டும் நல்லபடியா இருக்கட்டும் அஸ்ஸலாமு அலைக்கும் போடுறோம் ஏதோ ஒன்று பண்ணிட்டு we leave, but these kids are like, okay bye dude, Bob. We ask something, my niece say, duh. It took me a long time to understand what is duh all about. So, I mean, this is like the difference in the types of communication they have. And absolutely their academic worry is very, very high with these children because the pressure is being given by the parents. They are scared what will happen because they are giving a dynamite into the hand called as a mobile phone, which can give an access to every other thing. You click into one anatomy or to read anatomy, something else pops up. You just cannot cut that, it's a dynamite which we are giving, and academic worry is pretty much high for this because the pressure given by the teachers, given by the parents, given by the co-peers and by themselves is pretty much very high. And of course job security, all want to fly abroad, all wants to get somehow clear the NEET, or NEET is very difficult, something else that is very, very equivalently very high. So the job security is pretty much high. When they don't want anything, they will say that I don't want to read, I want to do organic farming. That's another new trend that is coming up. They all want to become entrepreneurs. Okay, that's another new later, I don't know, alpha generation, what next is going to happen. And then definitely an increased pressure to perform. Now, with my experience, as I told you, I've been seeing literally 200 adolescent students almost every day, my UG and PG students of psychology. forget psychology. But these kids, I've been seeing right from 2005, there's a drastic change in their characteristics, in their personality, in the way they express themselves. And currently, for the past 5 years, I've been making a note. We are making a lot of research work in this also. But I've just noted down a few of the characteristics very eminent in these kids are that they're all pretty self-centered. They're not able to think of another person very soon. But if they are working on a cause, they really pull in all the people together and they work on a higher level social cause. Both are very contradictory, but both are present in them. Instant gratification. எனக்கு phone வாங்கி தரியா, நாளைக்கு இது வாங்கி தரியா, அப்புறம் அது வாங்கி தரியா. So they think that that will give them a lot of pleasure, but then it's like a mirage. Once you get, it's not there. The pleasure is not there. Maybe the pleasure is somewhere else. Sorry, I made a wrong choice, but next time you buy me this, I'll be a good girl. So it's like a mirage. It keeps moving on and on. The parents assuming that, okay, இந்த வாட்டியாவது நான் இதை வாங்கி கொடுத்தப்பறம் she'll be a good girl. Oh, please forget it. Okay, and now there is something called as a FOMO syndrome, which is very common in these kids, is that fear of missing out. Now, my niece is 10-year-old, okay, she's about to eat idli for breakfast, and she's like, takes a snap of it, puts it immediately. Dude, what are you eating? And she puts a piece of sandwich and says, this is what I'm eating. So they have to be on touch. But if they don't touch the phone for the half a day, they are like lost. Amma, எவ்வளவோ ஆயிருக்கும், so much is there, and they take 300 messages, odd messages in the group. 10-year-old. What they talk, I really don't know. So, and the other thing is, they have a fear of being socially rejected if they're not keeping abreast with all this. They feel like they're going to be left out, lonely, all that. And now, the one very important thing is that relationships, I'm very sorry, right from the age of 12, the kids don't know what is the meaning of relationship, they get into it. Somebody asks them, சாப்பிட்டியா, தூங்கினியா, படிச்சியா, என்ன, இந்த கலர் உனக்கு நல்லா இருக்கு. Enough. These are enough triggers to flop this, the boy or the girl, and they get into fleeting relationship, not with just one boy or one girl, multiple. Okay, they do not know exactly what is a mature relationship. They do not know what is a relationship, but they like it. They like the electric current passing. So they get into a lot of fleeting relationships. It's very common among these. Quick to decide. இது எனக்கு செட் ஆகாது, நான் அதுக்கு போறேன். அது எனக்கு செட் ஆகாது, இன்னொன்று ட்ரை பண்ணுறேன். So they kind of cannot sit in one place. So they're kind of very, very fleeting. And most of them, though they do so much of work, at the end of the point they said, ma'am, எனக்கு வந்து எம்டியாக ஃபீல் பண்ணுறேன், வேக்கமாக இருக்கு, ஏதோ போர் அடிக்குது, ஏதோ ஒரு satisfaction இல்லை. These are the common words I hear my students saying, in spite of them being in several places. They are multitaskers. They are in several places, but there is a sense of vacuum in this. Now we are coming to the point. They have temper issues. You don't get them not because of our parents alone, but because of lots of issues. These kids have temper issues, and when they get into the temper burst, for them to get back to the normalcy, or what we call as a resiliency, is very, very slow, and by that time there's a lot of damage that is done. And there is a lot of maladaptive coping strategies, very, very high nowadays. Collecting material is one. High driving, சின்னதெல்லாம் வண்டி ஓட்டுது, அது வந்து all the name of the latest vehicles and all that has been there, and giving lot of importance to distraction. Oh, you're feeling very sad, let's put up ourselves in the gym and put bodybuilding. It's not for the health concept, it's to attract. It's to gain something else out of it. This is all secondary gains, which actually does not last longer or promote to these kids. Now, speaking more about the maladaptive coping strategies, a lot of them are there. I'm going to speak more about the self-harm. That's the topic I've been given. Several are there, blaming self, blaming others, all that. Now, I'm sorry there are a lot of children there, but I had to use these pictures. I was not aware that very small kids are here around. Now, self-harm is basically is nothing but aggression, but towards turn inside, because I cannot do anything outside. It's not making an effort. So what I do is I do it on myself. That is what the self-harm is all about. Now the root causes of self-harm could be several, which we're going to speak about. And it can range from an array of behaviors. Some very, very simple. Thalai vandu severla muttikkiradhu. Chinna pasanga kuda pannudhu. Edha vannu kudukalam urulradhu. Okay, that is one type. And then they bang their head. And for the fear, what we do, we go and hold it. That's a reinforcement. They do it again. Adukku muttikonga sollala, but they should be taught appropriately how to voice what they want. Okay, so that's one thing. And then of course kicking, skin picking, biting, burning, cutting and all that, but they can be mild to severe. Severe is definitely you need a psychiatric intervention or at least a consultation with the psychiatrist. Mild and moderate can definitely be handled by a clinical psychologist. Now, why do these kids do this self-harm? Many parents, I mean, to me, I was very surprised to see many of the kids under the burqa, under their dress. If you just open up, there will be at least 1 or 2 marks, which is very, very common in these kids in nowadays. Earlier when I was teaching and when I was reading in that college, it was not very, that is the concept. Currently it is different because the stress is enormous. They don't know how to cope with stress. And one among the maladaptive coping strategy is this, is self-harm. And there is a distraction from all this painful, oh, my father hates me, my mother hates me, they don't like me because I failed an exam. Nee eddukume like pada maata. Unna vachi enakku vandu perumeye kedaiyadu. Why are you like this? See, your the cousin brother is doing so well. Why are you like this? So of course indirectly parents also play a very important role, and due to other role pressures by the person themselves, the individual themselves, this serves as a distraction. One thing, there is a lot good control, because I don't have control over anything. The other ways are like binge eating, eating a lot, or not eating at all, or taking a car and just driving. Amma pata sollo the Monday eduthu poite irunga and don't know where you are, listening to loud music. So these are all distractions. Okay, these are all not proactive coping strategies, but they're distractions. So we should be able to teach them exactly what they are. We're coming to that. Now, this is way of cry for help. That's most important. Is that sometimes we may say, avalukku thimiru, avalukku idu, avalukku inna kora onnume kediyadu. It is just a cry for help, and we need to address that ASAP. Now, some people who have self-concept issues, most of us have self-concept issues. We all have to agree to that. We are overcome it. We have either studied or we have performed somewhere and we are in good post. But we do have something called as a self-concept. All of us do have. And when these kids have predominant self-concept issues, the best way is, this is how things happen. And cold and abusive parents, being bullied many times, can lead to self-harm. Now, how do we manage the self-harm? I'm going to speak only about the psychological pattern. Is that I strongly believe in teaching coping strategies to these children. The first thing is that give them good counseling. Counseling means actively listening to these children. But parents sometimes, avanga pesambodhu adalla chumma solra. So they try to cut the conversation and they try to say, உனக்காக நான் என்னெல்லாம் பண்ணுறேன் தெரியுமா, நான் உனக்காக எப்படியெல்லாம் நான் கனவு கண்டுருக்கேன், எவ்வளோ பேங்க் பேலன்ஸ் உனக்கு சேர்த்து வச்சுக்கேன். The ideas they have for the children is genuine, it's true, but the delivery is sometimes really messy. Okay, the intentions and how they deliver it to the children really doesn't match. So that's where exactly we need to work with, is counseling with, listen to it with open arms, accept the child as a child. Whatever fault the child has, whatever is not very good at something, it's okay to embrace the child and make the child feel very good. And depending on whether it's a crisis intervention or is it just a support therapy, the counselor decides what to do. And then of course, group therapy is something really works wonders. Sometimes we have similar minded children who have self-harm to sit together and they talk about it. And there's a lot of cost benefit talk. Idanala unak enna nanma, idanala unak enna theema. So nanmaigala first we will let them talk. Enak idu vanduchu, enak idu aachi, enak vanda I felt good, I felt I got attention. Then we switched over to saying that, is this the only way of getting attention? Is there better ways of getting attention? Is there something called as a consequential thinking? Because there is impulsivity which is driving them more than, they don't think, they just cut. And cut gives them a lot of relief. You can't even empathize with it, I can understand that. But these kids, when they cut, they feel so much of relief and they feel that the pain is such a beautiful distraction compared to all the mess around them. So we need to work on all that, and family needs to be really brought in there. It is such a shock to the families initially when I speak to them about this, but eventually when they're able to accept the child, they kind of really sober down. Now, I like to usually teach them about how to cope strategies. If you can really work with the problem, if you can really work with the problem, then we use problem coping strategies. How to plan, how to organize, manage your time and all, and blah, 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 all the other things. But then you can't do anything about the stress. The person is lost. The relationship is lost. You have failed in an exam. What can be done? You can emotional focused coping strategies can be done. You can ventilate for a while, you can go for a run, you can take a class, you can do some journaling, you can relax, you can exercise, go for a movie, go with friends, blah, 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 whatever. But that's, you need to know it has a limit. Some people enthrall themselves by going into lovely, big, huge vacations, like after vacations, buying things, making themselves feel good. But I'm telling you, distraction and coping, there are two different words. We need to know the difference. And I truly believe in the way we are thinking, because there is, by Aaron Beck, is a very strong theory, very, very done for the past 5 decades, very strongly done in the field of CBT, is that thoughts is the actual culprit. What you think affects our behavior, and what our behavior affects our emotions. So now, we like to work it backwards in the way we alter the ways a person is thinking. Now, I've just given you a couple of examples there. Whenever you feel like I'm worthless, I'm so stupid, I'm so foolish, when they say, maybe you messed up in this, but is it sure that you're messing up everywhere? Okay? There's one more thing, nobody likes me, I'm a loner. Now you need to say, give me the evidence that nobody likes you. No, annikku party ena thitnanga. Of course, party also gave you a halwa the other day. Why didn't you think about that? So we will do the pros and cons, and we make a division and say, oh yeah, I mean, so we come to a conclusion that this assumption should not become global and keep on saying, nobody likes me, nobody likes me. It becomes you. So that is where cognitive behavior therapy works, is to how to modify this negative automatic thinking, the assumptions a child has received. So we filter all the assumptions a child has by intensive counseling, and then we change those assumptions to a more promising one. And this is the last slide. It all has to grow from the beginning. I really vouch a lot on my parents and the teachers whom we are with our kids. That's why PTA meeting is made compulsory in college. Parent-teacher meeting in college, school, I really feel that it really makes a lot of sense, is because they need to really know what's happening to their ward. Okay, so early detection is something we really vouch on. The next is, please have quality time with the children. 15 minutes a day is enough. And the 15 minutes, undivided attention. Your talking should be very less. Your children should be able to talk. Don't cut. When you cut, the child knows what to tell you, what not to tell you, and hides. And when it hides, it goes and speaks to somebody else who's just not technically competent, and they can mess your child's mind. So might as well quiet up and listen to what all the child has to tell you, and inculcate what is she undergoing, and work with a plan. Okay, and then please use appropriate reinforcement. Now this dance, I really appreciate Srinivasan sir's concept of, saying that dance is express yourself, use art therapy, use play therapy, use dance, use all possible methods where you can cathartically release your energy, and not something like the previous slides. And the parents need to be very careful. I will never say, please don't argue, please be ideal parents. Not possible. We have to fight. Sometimes we'll fight, and sometimes they will listen to us. They're very sharp. But what I'm saying is, when you're fighting, when you have an argument, when you have some domestic issues, have a closure. Sari, ipo enna ayipochu, idu mudinjudha, sari, ini neenga idu pannunga, naan pandren, okay. That closure has to come. Many families never do closures. They just say, நீ எப்பவுமே அப்படிதான், அவங்க அம்மா எப்பவுமே அப்படிதான், அவங்க அப்பா எப்பவுமே. The kids are learning how to work. They see what is the strategy which is here. When the mother doesn't talk, everything falls into place. So the child learns, when you don't talk, you can control this. But father gives one fat to the mother and everything comes down. The child learns, you hit both the girl child and the boy child. Everything comes to them. So they become, one of my client very previously, she said, I'm Mary Com. Why? I hit, everything falls in place. 6-year-old. Okay, so now the last point I would like to say is, please unconditionally accept the child with whatever flaws and whatever nice things. Please accept the child. Be less critical of the child. Finally, whatever we are comparing, have some pinch of salt, but it's okay. But to being too critical, too judgmental, keeping it an ideal with your perfection, these are things which will never fall. It doesn't work with the children. And a self-concept is the core of any child, and self-concept only flows as the personality of the individual. So once the child feels accepted and nurtured, it does not spill into any maladaptive coping strategies very soon. So 50% of your problem is sorted by the age of 12, when you have accepted and engaged the child in a more proactive way. So with that, I would like to thank you all for giving me this wonderful opportunity, to the Global Welfare Association, Dr. Srinivasan sir, Professor Vimal sir, and Kannan sir. Thank you very much. Bye.
I thank Dr. Kavita for your excellent presentation. The important thing here, Dr. Kavita has emphasized, is how to spend quality time with the child. And last time, that is more important, and that is going to be the reaching home point, I would like to say. Now I would like to invite Dr. Karthik, who is again going to speak about an important issue, anger. கோவம் குழந்தைக்கு வந்தால் என்ன பண்ணலாம்? அடுத்து ஏற்கனவே டாக்டர் கவிதா பேசுகிற மாதிரி, வாட் இஸ் கோயிங் டு ஹேப்பன் இஃப் த சைல்ட் ஸ்பெண்ட்ஸ் எக்ஸசிவ் டைம் இன் செல்ஃபோன்? அதிகமாக டிவி பார்க்குறான், அதிகமாக டேப்லெட்டில் பார்க்குறான், அதிகமாக செல்ஃபோன் பார்க்குறான், இதெல்லாம் இருந்தால் என்ன பண்ணலாம்? அது ஹவு டு அட்ரஸ் தட், ஹவு டு மேனேஜ் தட், எப்போல்லாம் டாக்டர்கிட்ட கூப்பிட்டு போகலாம், இல்லை என்ன பண்ணலாம் அப்படிங்கிறதுக்கு டாக்டர் கார்த்திக் வில் கம் ஆன்லைன். Over to you, Karthik. Thank you.
Let us say his name is Babu Ganesh. Let us call him Bablu. He is a teenager. This Bablu is going to come throughout our presentation, and I take this chance to thank for giving me this excellent opportunity to talk on this great topic. But most of the, as a last speaker, most of the things has been already covered. I try to add whatever points I am able to. So now there is a job for you. You have to say who have said this quote. Okay, before going into the quote, I will say a scenario where it is why parents are finding it very difficult to handle a teenager. So I already said Bablu is a teenager. All the mothers first they go to a doctor called Dr. Google. Okay, they don't believe us or any psychologist or psychiatrist. Both the positive and negative emotions. They could not able to channelize the energy which is pouring in. Both the positive and negative energy. So the role of the adults and the teachers and the parents is to just to regulate them and not to hamper them. We should not put the brake. We should put only brake at the essential point. We should not snatch away the car saying that he is driving rashly. Everybody will drive rashly at the initial point of the time. Only with the training, everybody will drive in a certain way. So adolescence is like that. Adolescent brain is like that. It is not used to any experiences. Every experience is new, and the elders' way is to not to criticize them and to cut short the activities. They should encourage them and they should advise them and suggest them when to put the brake and how to ride a vehicle. That is the important activity of the parents and adolescents. So this is the like an BMW car. The brain are very much efficient, but they don't know how to ride. That is the problem, which causes the problem to others. We should teach them or suggest them and be a role model to them to how to drive their own brain. So that's the thing. And this is the thing, coming to the anger. So anger is not a negative emotion, okay? Any emotion is not a negative emotion. For example, I say, I hate being idle. So hate is not a negative emotion because I am having the hate towards a proper thing. So every emotion is a needed emotion. So anger is also a needed emotion. That's why the popular Tamil poet Bharadiyar said, Rautram Palagu, practice the anger. You have to practice the every emotions. We should have the emotions. So how to show the emotions and what are the places to show the emotions? The way to show the emotions is the real thing rather than not having the emotions. Don't say to any teenager, don't be angry. Angry is a negative thing. Don't be depressed. Depression is a negative thing. So you should always ask, what is the cause for the anger? What is the cause for the depression? How to overcome this? How to use this anger? How to use this depression to come out of it? That is the way we should deal with rather than blindly saying that these are the negative emotions and these are the positive emotions. And funnily, this Bharadiyar's father wanted him to be an engineer. I'm talking about 130 years ago. He wanted his son to read in English and wanted to become an engineer. Fortunately, Bharadiyar didn't listen to his father's suggestions. So we should enable the adolescent to follow the passion. Then only they will excel rather than push our passions into them. That is the major thing. That causes the anger most of the times. we are pushing our own rules and own dreams upon them. That causes the anger. So this is in one slide. These are the different problems these teenagers are facing, which leads to anger. And the first and foremost problem is depression. So this is a very simple way. Just ask 3 questions to your whoever person, teenagers you find they are behaving in not a normal way. Just go them and ask them how they are feeling. Whether they are feeling sad throughout the day, most part of the day, and whether they are not getting any pleasure from any activity. For example, you see a person is a cricket fan, but suddenly he lost interest in watching a cricket altogether. So then it is a symptom that it may be in part of a depression, and he is even thinking and walking on the even day-to-day activities become very tedious for him, normal activities. So these 3 questions you ask, whether you feel so sad often, you could not able to derive the pleasure from the activities, and whether you are feeling very tired. So if these 3 things, at least 2 things are present, he is having a depressive episode, and you should make him to attend in counseling if necessary to a psychiatrist thing. Another thing, excessive importance to the self-image. Teenagers were very worried about how they look outwards. I mean, how the people will perceive them. They will have a minimal social anxiety. Even the best of the best will have a minimal social anxiety, and they will have fear towards how they will be criticized by the elders and the colleagues and all these things. So they have an extreme self-image problems. And again, as already dealt with the academic problems. The problem is in academic, as Deepikan rightly said, is not about reading and writing. The learning education has a lot of things. For example, if there is a great athlete sitting in the class, they will call him scholastic backwards. Even the running a particular distance within a few minutes is a learning. So we does not count this learning as learning, and we always call reading as writing as learning. One may be an excellent cook. We'll miss him and call him a scholastic backward. One may be an athlete, excellent cricketer. We will call him a scholastic backward. So that is the problem with the system. That is not the problem with the adolescent, which leads to the person who does not have scholastic, reading and writing abilities and having all other abilities, spending 8 hours in the classroom he feels like he's trapped. Naturally, he will become angry. This is the problem of the system. This is not the problem of the adolescent. Our Indian system has to be changed drastically, because this is the main problem most of the teenagers are facing nowadays. And I already said social media issues. I will come to the later. And again, one thing is called bullying. Whenever your one student or the son or daughter is having a depressive episode, or they are behaving in a normal way, I always ask them whether anybody is bullying them. This is the most common cause for depression. Even now, the cyberbullying has become very prominent. Even in Facebook and Twitter and all the social accounts, there are few people, they always try to abuse the others. And the adolescents are so sensitive to criticism, they take it into heart and they will become so depressed. So always ask them whether they have been abused. So for them to express to you about abuse, you should be little bit friendly to them, and you should have a rapport to them. If you are emotionally cold and aloof most of the part of the time, and suddenly you go and ask, they won't reveal it to you. So when they are at the abuse and they have no other person to go for, they will go in for a severe depression. So you should be always available for their personal needs and emotional trauma. So then only they will say the bullying experiences, which is the most common cause of the depression and which leads to the anger episodes. And one other thing is sex education. We should education about sex from 11 to 12 years of age. Whenever for example, when we want to train a pilot, we won't say you go and write the pilot, make you airplane, and you will yourself learn. We will never do that. Okay. Before starting the thing, we will say what are the things to be, how the machine is operating, what are the things you have to do while taking off. So similarly, sex is a very complex thing. We should talk about each and every step. Suddenly, if it doesn't talk about in 10 or 11 years, suddenly a girl is getting menstruating, she will be terrified by the normal physiological thing. Same thing happens to boys also. Suddenly a person is getting ejaculation, having an erotic thinking, he may think something is severely wrong with his body and his mind. He may go for depression, it may lead to an anger issue. So before going into the adolescent, we should go without any stigma. We should openly talk about the sexual thing, the desire, attractions, and the act of sex, and how to, all these things should be learned to them is based in a basic way. On what base they are, we have to teach them each and every step. So that is the essential thing. Due to the sexual lack of knowledge, so normal physiological activities become the stress for the teenagers, and it will express in the anger issues. And then one of the important thing is identity crisis. So many teachers, if they ask what the students want to do, most of the students will say 70%. It is a global phenomenon. It is not an Indian phenomenon. 70% of the students will say either a doctor or an engineer or lawyer or a teacher. So, so this is the four things they used to say. But ideally, if we have taught them correctly, they have said different things. 100 different students to say 100 different things. So we are more focused on only studies that people are saying these things. So identity, we have to make the adolescent to explore all the possible avenues. One person who is physically very active, so we should make him to go for a regular basis to an play. So if somebody is very active in music, interested in music, dancing or singing or playing, we should encourage them to. So before that, whether they are interested or not, only we expose to them, only they will know. So which classes they are attending them with an interest over the course of time. 2 to 3 years, along 3 years, we are exposing them to different things. Certain things they will fall off. I don't want to go. I don't have interest to go. But certain things they will sustain for periods of time. That is the passion of the thing. That is the thing the brain is naturally capable of. Then we have to encourage that. That is our part, rather than pushing him to be a particular thing, best academic thing. So this is the major problem every adolescent is facing. And again, how to manage it? These are the different things which produce anger. So anger is like a fire. Okay, we should extinguish anger. And most of the times, what we will do? Most of the times, the parents and teachers, if the teenager becomes angry, they will become more angry. The parents will become more angry. How dare you are able to shouting like? How dare you are doing like this? And teachers also will be saying the same thing. How you are behaving like this in front of everybody? You does not have any brain or something like that. They will keep on blasting the teenager. But remember one thing: fire never quenches fire. Fire will accentuate the fire. If you want to manage anger, you have to be calm. An angry parent, an angry teacher could not handle an angry. So this is a simple message. So for that, both you teacher and parent should have mindfulness, and they should teach the students also the mindfulness. Mindfulness is nothing but, if you look at, if you are giving advice to others, you will give very excellent advices. But when you are advising yourself, you will be very terrible, because this happens to everybody. Because when something happened to us, we have a different way of thinking and emotional process, because we does not dissociate our own thought process and own emotions as happening to others. That is the best way of handling things. If I am become angry, that does not become righteous because I am angry. So we should not personify ourselves with the anger. We should always analyze our own emotions, analyze our thought process. Like Dr. Kavita said about how to change the way of thinking secondary to the emotions. That is what we do in therapy sessions. So that's the mindfulness is the treatment for most of the stress the adolescents are facing. So everybody should be aware of this term mindfulness and mindfulness-based therapies. The teachers should train themselves in mindfulness, and they should teach regularly to the students about this mindfulness, because this is the ultimate thing that will handle the anger issues. Then communication skills. So communication skills is very much important. There is one technique called sandwich technique. Okay, so if you look into the, for example, let us take super singer, junior super singer. they will criticize the singer, the small singers after singing. They will say, why you have not sung this song with Shruti? I used to think, who is the girl Shruti? This is a solo performance. Why they are asking me to sing with Shruti? But if you look at when you late SPB sir, the great Balasubramaniam sir, when he is criticizing, he will always put the criticism in between two accolades. So first he will always start with, you sung extraordinarily well. Then he will say where are the places that person has gone wrong. On finishing, he will appreciate the person for the efforts put and the song being selected and the way he come out and sing. So here, this is the way of delivering things to the adolescent. You are the role model. So then only they will catch up from you and they will start communicating in a certain way. So this is what we call a sandwich technique. Always put criticism in between the two appreciations. That is one of the thing. And one other thing is everybody knows a breathing technique. So, sir, every adolescent and adult should do all these things in the morning, because you should have a baseline peaceful mode only to have not to be escalated anger when stressful situation comes. If the base itself is very stressful, then you will prone for frequent outburst, anger outburst. So for this early morning, they should have a breathing exercise. The simple thing, you have to breathe in and breathe out very slowly. So rather than the fastest breathing in, the breathing out should be prolonged. So this will activate the central nervous system, which is meant for relaxing. Again, progressive muscle relaxation. If you go on the YouTube, there is a lot of videos regarding progressive muscle relaxation. The same thing, you have to tense the muscles, and you have to slowly relax the muscles from head to foot. This is only a 5-minute procedure, but it will give an immense relaxing effect. These are two simple things which will give an immense relaxing thing. So everybody should make it as a habit. So now this is, you all know, this is a teen women cricketer who is a sensational in the world. He is called Shefali Verma. She's a mini form of Shehwag. Okay, she has a. So what they say is play is essential for endorphins. The play means not for example, Bablu used to say, I'm also playing, but I'm feeling stressed out. But what he is playing is, he's playing temple run. I have run 10,000 kilometers today, but he is not run. He is done in a video game. That is not enough to produce endorphin. So to make endorphin, which is a natural system against the pain, brain pain. Okay, thus we call it stress. So everybody, if they have a physical activity in the form of play, they will produce endorphins, which will mitigate the stress of the teenagers. So we should encourage them for the regular physical activity, and everybody should have a let out. So something they may think they could not able to say to the the parent or a teacher, but they should have a let out. In the olden days, they used to talk to a tree. Most of the time, they used to talk to a tree, because tree is the only thing which will keep secrets. You can't even believe in cat or a dog. They will show you with a wag of a tail. Okay, they will so best way is to talk to a tree. But now the tree has been transformed into a pages, isn't it? Every paper is made of a tree. So whatever things they want to let out, they can let out in the write them and destroy them or burn them, or they will type it in the smartphone and then can delete it. But they will have this habit of expressing the things which not to be said to themselves, which has a very relieving kind of thing. So this should be taught to them. And again, as emotions, the thing which is mostly integrated with emotions is music. As emotions hijacks the brain, the music is the only thing which has the capacity to hijack the brain. So listening to and relaxing music on a day-to-day basis is the best effective way of handling the thing. So we should always, so whenever everybody hears and Beethoven's Ninth Symphony, if they are depressed, the science itself is saying that this music is hijacking your brain and pull you out of the depression. That piece is called as Ode to Joy. Okay. So make them to listen to all these musical pieces. So these are the practical ways. Then I'm going to think where we should always create in certain boundaries. Okay, teenagers can become angry. We will be very calm even when we become very angry. But there are certain boundaries. If they cross that boundaries, they will face the consequences, like cutting themselves with the as the previously said, cutting themselves or harming themselves or trying to harm others. For example, so self-harm in any way, we should become very serious, or harming others, hurting others. We are hearing he's hitting others and beating others or breaking the articles in the school or house. This is the time they have to taken for professional help. We could most of the times parents and teachers are inadequate to handle such a thing. So when the persons are doing it often, more than 2 or 3 times, this is the time we have to take them to the professional help, to a psychiatrist or a psychologist. So now come for the addiction. So as shown in the picture, the Bablu has been tied by lot of wires, gaming wires, music wires, and tablet, TV, and laptop. So there are a lot of screens are making this Bablu addicted. And most thing again, alcohol. Western countries, it is more common. Even India, it has been raising teenage consuming and alcohol. mostly when they are in unsupervised environment, when dysfunctional family, when there is nobody to supervise, they often get goose themselves and lie down. So over the piece of time, they become addicted even at a very young age. But we should be very careful. Everybody should be very careful. What are the common household things that become very addictive for the adolescent? That is the challenge for us. We should know what are the things, the common things that become addictive. One thing is cough syrup. When a very elderly grandmother, grandfather is having a cough syrup, suddenly you are seeing half of the bottle is missing, the complete bottle missing. You should be very aware that most of them adolescents try to abuse cough syrup because it contains a very minimal amount of alcohol. So what are the other things? If you see sometimes when an adolescent is doing such things, sniffing from a bag, you should be careful because he is having an addiction problem. What are the things you should stop? So some simple thing like this room freshener or a deodorant. So when a person is using excessive deodorant or like this spraying on the face, you should be very careful. They become very addictive. And then the simple, as simple as that, glue we are using to stick, like Febi Bond, the glue we are using to stick, and again ink remover. So all the ink removers, erasers. So these are the things which won't be very addicting. So they should be very careful when we are finding them. They are using these things more than appropriate. So then come for the gadget addiction. Because this is the major problem now we are having. So previously there is where we used to say there is a Bhutam called genie Bhutam. Okay, if you ask anything, if you rub the lamp, it will come out. If you ask anything, it will give. Then suddenly this smartphone has become the genie Bhutam. Okay, you rub it, it will come. All the apps will come. If you ask it, it will give. So everything is in your hand. It can be used in a positive way, but sometimes it may go in a negative way. So what are the signs? As I already said, we should not restrict gadget use. Okay, we restrict gadget use in the sense we should limit the time, but we should not say you should not use the gadgets. It becomes the part and parcel of the life. Okay, never say to every adolescent you should not use the gadget. Always make them to say how to use the gadgets and what are the things you can use the gadgets to think with, and when what are the time you have to worry. When they are using the screen time even in the nights, so after 11 o'clock, 12 o'clock, that is a sign they are getting addicted to the smartphone. Then they are keep on texting even while walking, while driving or walking, while working other things. They are keep on seeing big texting often. Then there is a sign for addiction. This is called as text work. This is very dangerous. Most of the accident happens due to this text work. So teens are known for doing more text work than the adults. And one another thing is this is taking the cell phone to the toilet. So 2 years back, there is an interesting thing happened in Mumbai. Okay, a teenage boy taking his cell phone to the toilet, but he ended up fire engine came and come to save him. What has happened is this boy was secretly taking the cell phone with the knowledge of the mother's cell phone. Father does not like him to using his cell phone. So he often goes to toilet to use the cell phone. He drastically drops the cell phone into the, it's an Indian cell phone, into the sinkhole. So he put the hand in to retrieve the smartphone because the father will scold him a lot, but his hand got stuck in the Indian toilet at the sinkhole. So the fire engine has to come and retrieve him from the thing. So if you see often a teenager is taking the cell phone and going into the toilet, this is a sign that they are getting addicted to the smartphone. One other thing is using the smartphone in spite of having humans around them. Like a table when we are eating as a family together, when your friends are going outside, they are eating together. If they are eating, each and everybody using a cell phone instead of talking among themselves, that is the sign that it is an addiction. I am not saying only for adolescents. These are all the signs, even for the adults. So these are all the signs they are getting addicted for the smartphone. And again, as I already said by Dr. Kavita, this is fear of missing out. So even 2 days, 3 days, they are not using the cell phone. We make them not using the cell phone. They think that they missed out a lot. They have been out of the race. So in the Facebook, Twitter, everybody would have updated a lot of things and they have missed out the race. It's a fear of missing out. So they always keep the cell phone with them. 24 hours. They will keep it in the handbag while sleeping. They will keep it behind the pillow, and they often check at the midnight, 2 o'clock, 3 o'clock. They will suddenly get up and check whether the mobile was with them. So this is the sign, definite sign for addiction. So best way to make them come out of addiction is you should be the role model. You should not be, for example, one comic thing has happened just recently. Your mother called me, my son is addicted to smartphone, I want to meet you. So I gave an appointment. It was Saturday, I gave an appointment, please come around 7 o'clock in the evening. So suddenly the mother said, sir, I can't able to come at 7 o'clock, sir. Oh, what, madam, why you can't able to come? Sir, that is, the Roja will be running in the TV, sir. I have to watch Roja, sir. I was thinking, oh, Roja is a very old movie. Why you are watching it now? She said, listen, this is a serial. I'm keep on seeing it every day. So then come on 7:30. So sir, 7:30 there is one serial called Swanate Pola. Then come on 8. So 8, sir, there is another called Kuve Unakaga. I don't know why every serial is named after a movie, but strangely. So I gave an appointment at 9. So suddenly father got the pain, sir, I have to go to the pub today, sir. This is Saturday evening. So let us, can we come at 11:30? I said, yeah, at 11:30 you won't be in a position to drive. So come in the Monday. So again, they are not going to come in the Monday because the mother is addicted to the cereals and father is addicted to the alcohol, and they expect the adult child and adolescent not to be addicted to the cell phone. That will never happen. Okay, so if each and everybody has their own addiction, adolescent will have their own addiction. So you should be the role model. You should not be addicted to anything, and it will teach indirectly the person to come out of the addiction. And you should always, everybody should have a family time. So in the dinner, they should put the cell phone away, and everybody should sit in a place and have a dinner without watching any screens, talking among themselves. This is a very rare practice, isn't it? This used to be very common once upon a time, but it is a very rare practice. But this is the thing they are saying to prevent the addiction. We have to cut the chain. We have to cut all the possible venues we can cut the chain. Is one of the time is having a dinner together with the family. That is the best way. Then you should always have a gadget-free days. At least 4 to 5 days in a month. You should every Thursday or every Friday. We should not use gadgets. Only for basic essential thing to make a call, very emergency call. For all other things, the gadget should be always in the off in the silent mode, and you should go for an occasion. You should travel. You should have another photography through a DSLR camera or any other thing. Any other activities not using your cell phones. So that should be the thing. So this should be made as a practice for whole family, not only adolescent. Then one adolescent also will be introduced to a lot of things that is pleasurable more than smartphone. Without we are introducing them to a lot of pleasurable things without smartphone, we can't get them that they should come out of the addiction. We should not expect. And then always limit screen time. They say 1 to 2 hours of screen time is permissible in each every day. So even this 1 to 2 hours, ask them 1 hour, whatever they want to see. With the other 1 hours, you introduce the apps which are brain building, puzzles which are brain building, and a lot of games which was brain building, which was very constructive. There are a lot of things is constructive in the smartphone, and introduce them each and everything. So 1 hour they do whatever they want. 1 hour they do the things which enrich them. So this is the way to handle them rather than blocking completely the smartphone. After completely addicted, we should block them for a period of time. That is essential. Before addiction, to prevent the addiction, the best way to do introduce the thing a very limited way. So this is the main thing. And this is my last slide. So the same messages I'm going to give as I previously said and emphasized. And what is the thing which we have to do is we should have an unconditional love towards the adolescent, irrespective of the color, creed, or the background. The teacher should unconditionally love the adolescent. From that love only comes the solution. If you don't love a particular person, you can't give a solution for that particular person. If you love that particular person, the solution will automatically come. We should not discriminate anybody regarding the behavior. Each and every abnormal behavior has its own root cause. If you go and remove the root cause, the abnormal behavior will vanish. Every child is a gifted child. Every adolescent is a gifted adolescent. So that is my message. So adolescence is a most beautiful period. Adolescent, the word itself is called as budding adult. He is half child, half adult. He will be a child in a certain ways. He will be an adult in a certain ways. We should know when he is behaving like that. We should act when he how to behave, respond to it. When he is behaving like a child, we should ask an adult parents. When he is behaving like that, we should treat him as a buddy. So we should be highly flexible regarding the adolescent. We should not ourselves become emotional. we should be very supportive, and we should be very supportive in the sense they should open up any issues upon them without anything, and we should not have the stigma. If there is a boundary crossing behavior also there, we should always, without any stigma, to take the students to the professional counselors or professional psychiatrists. Thank you very much for this opportunity. Thank you.
Full presentation, especially touching upon gadget addiction and other things, useful points. I thank all the three presenters for their excellent inputs and thoughts to the parents, and I hope this will become a continuous yearly session at least to help the parents as well as the teachers in improving the mental well-being of the adolescents. Thank you one and all. Thank you very much. I'd like to invite Dr. Srinivasan for a concluding remark.
I thank all the eloquent speakers. They were illuminating with their thought process, with the researchers, and the psychological and clinical approach for handling this very, very serious issue. How many percentage of people are dying or how many percentage of people are suffering is not important. Even if one life we have lost, it makes a lot of difference to us. So each one of us have a very, very basic responsibility to see that we complement each other. We live and we let live others. That's our motto. We'll contribute for the happiness of everybody. We'll contribute for the success of everybody. We will handhold and grow with all. This is what is all life. We have nothing to lose by helping others. But we have everything to lose if you are not going to extend a helping hand for the people. Mistakes do happen. After all, we are humans. We are not divine. If I don't commit mistakes, when am I going to learn? Committing mistakes is a way of learning. Unless otherwise I try, I am not going to commit mistakes. Unless otherwise I commit mistakes, I am not going to learn. If I am not going to learn, I am not going to grow. So to learn is to grow. With these words, I thank each and every one of you for making this forenoon session a grand success. We request you all to join us post-lunch at 2:30, madam. Gayatri, madam. I will ask them to join at 2:30 back in the Zoom for the dance program. Please join us at 2:30 p.m. Thank you very much. I thank Dr. Vimal Joshi for the excellent coordination. Thank you very much. Thank you, Dr. Venkateshan. Very nice of you. I'll request all the speakers to take the dais, so the children who are going to dance stand with us and take a photograph along with the teacher. Sir, please. We have to honor the children. That's more important. Thank you.
Takadimi takajanu, 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 takadimi takajanu. Dirgadom, 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 dirgadom. Tat, tajam, tat, tajam, kirta dirgadom, kirta dirgadom, kirta dirgadom. Takadina tam. Tak tajam tak tajam tak tajam tak kirda dirgadom, tak kirda dirgadom, tak kirda dirgadom. Takadina tam. Tad dit tad tajam tad dit tad tajam tad dit tad tajam takadiku kirda dirgadom, takadiku kirda dirgadom, takadiku kirda dirgadom.
तांडव गणपति सतिमितो मेरा 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 तांडव गणपति ஆண்டவன் கணபதி அருளிடவாயன 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 தாண்டவ கணபதி அதிமித்தோ என தாண்டவ கணபதி நர்த்தன கணபதி நளினமே பார்த்திட நர்த்தன கணபதி நளினமே பார்த்திட கதிரி தோமன சிவநடன துள்ளிரே ததிரி தோமன சிவநடன துள்ளிரே நர்த்தன கணபதி நளினமே பார்த்திட ததிரி தோமன சிவநடன துள்ளிரே நர்த்தன கணபதி நளினமே பார்த்திட ததிரி தோமன சிவநடன துள்ளிரே தாண்டவ கணபதி சதிமிतो मेरा तांडव गणपति सतिमितो मेरा तांडव गणपति तांडव गणपति तांडव गणपति
We now have Dr. L. Srinivasan to felicitate Vimal Joshi, Assistant Professor, Psychiatric, Chennai Children's Hospital. We now have Professor Dr. Kannan, who has more than 14 years of teaching experience in the field of mental health and mental well-being of children. He has conducted multiple researches in children scholastic backwardness and positive mental health in children. We then have Ms. Kavita Dhanraj, MPhil, Clinical Psychology, who is the Assistant Head and Assistant Professor in Psychology in J. Bass College for Women.
She has achieved the eminent clinical psychologist award.
She has achieved Eminent Clinical Psychology Award and also the Young Achiever Award. We now have Dr. R. Venkateshan, MBBS, DO, Resident Medical Officer, Institute of Child Health and Government Hospital for Children, Egmore. We also have Dr. Eril Arasi, who's connected with us online. She is an university topper in MD and she has served as professor in Tiruchi, Chengalpat Stanley and Madras Medical College, a dynamic director, capable administrator, fully devoted to welfare of child.